welcome to the Skin Cancer Center. I'm Dr. Pavlis. Here at the Skin Cancer Center, we provide a comprehensive practice in the management of skin cancer. We provide detection, prevention, and treatment of a broad range of skin cancers. We do skin checks, we prevent skin cancer, we perform excisions as well as Mohs micrographic surgery. So I'm going to show you around the practice. So if you come this way, this is our surgery side of the office. On this side we have 5 surgical rooms, and they're outpatient surgeries. However, we're able to provide very state-of-the-art cancer care. So let me show you in here. So this is our patient chair, and this allows us to get the patients into a comfortable position. When we're doing surgery, oftentimes we're doing surgery on the head and neck. However, sometimes we get skin cancers on our hands, our feet, our legs, so we're able to get a patient comfortable in order to perform their surgery in the most comfortable way possible. Our patients are awake, so we are very mindful of making sure they're comfortable throughout the procedure. So we have a surgical tray, we have surgical lights, and we really are able to offer a very high-tech and safe outpatient surgical experience. When we perform Mohs micrographic surgery, we're able to get complete clearance of the tumor as well as take as little healthy skin as possible. So in order to do that, we need to process our slides here in the office. We have a lab that allows us to section the tissue, and then we as physicians serve as the pathologist in order to look at the tissue to ensure that the margins are clear, meaning there's no more cancer left in the patient. So over here we bring our specimens to the lab, and we have lab technicians which process the tissue and are able to get us the slides within 20 or 30 minutes, so it's actually a pretty quick procedure. So this is our Mohs lab. After we take the cancer off of the patients, we bring the specimen here to the lab. And we have lab technicians who come over and section the tissue, meaning cut the tissue into small little pieces. And they use these machines to make them microns thin, so very thin slices of tissue around the whole margin or the side of the cancer. After they put the specimen on slides, which look something like this, they bring it over to a stainer, and this allows the tissue, which is in a patient clear, get colorized so we can see it under the microscope. So next I'll bring you over to our reading room that kind of shows you how we determine if there's cancer left or not.
I'm Dr. Carlos Gomez-Mead. I'm a board-certified dermatologist and fellowship-trained Mohs skin cancer surgeon. And so just to kind of walk through the process of what we do is after we surgically remove the skin cancer from the patient, the tissue is then processed in our lab, and then microscopic slides are made, and they kind of look like this, and we're able to evaluate those slides microscopically and look for those cancer cells, and the tissue is mapped in such a way where we're able to identify and locate exactly where the skin cancer cells are on the patient. And what that allows us to do is to minimize the amount of normal skin that's removed from the patient and try to really pinpoint and target where the skin cancer cells are going. As you can see, we have the slide here on our microscope, and then the tissue is oriented with colors, and so we're able to tell where left is on the patient, where up is, where the deep part is, and all of the margins are able to be evaluated on this microscopic slide. And here you'll see some basal cell skin cancer cells that are involving the tissue, and with that we then map it out with our Mohs map, mark it, identify it, go back on the patient and remove exactly where the cancer cells were positive. And we'll keep doing that process until the margins are completely cured or completely free with a very high certainty. And that allows the patient to have the highest cure rate possible, and also allows the patient to have the smallest wound possible. And that's what makes our procedure very unique in what we